Hello and welcome to the Krieger Institute of Plastic Surgery. I'm Dr. Zal Krieger, Director of Patient Education. I'd like to, during your initial consultation for breast augmentation, I'll begin by taking a careful history and finding out what prior surgeries you may have had, specifically any breast surgeries that you may have had. We'll begin by focusing on the four main decisions that you'll have to make when you're deciding to undergo breast augmentation. The first is what type of implant to use, and the options are either silicone or saline, and in your visit we'll talk about the various advantages of each one. The second decision is the size, and that's the one we'll spend most of the time discussing. I'll go over many pictures with you and show you various women, and we'll find someone who has a similar size to you starting out, and we'll find someone who ends up a size that you're happy with, and then I can tell you what implant they had so that you get an idea what size is best for you. There's also an upper limit of size that can still give you a natural, not fake appearing result, which is obviously a goal of ours here. And so we'll spend a lot of time going over, looking at implants, taking measurements, and looking at the book of implants and talking about what the various size options are. Many women require even a second visit and phone calls and emails to come up with the size because this usually is the biggest decision. The third decision we'll make is whether to place the implant above the muscle, which is oftentimes termed subglandular or subfascial, or below the muscle, which is termed subpectoral. And there's advantages and disadvantages to each approach. Generally, we place them underneath the muscle, but it depends, and if you're a candidate for either one, we'll present either option to you. The fourth decision is how to place the implant, where to make the incision, and there's various options for that as well. Most of that depends on your own anatomy, the size of your areola, the shape of your breast, where you want the scar to be, how you scar, decisions like that, and again, that'll be based on what we find during your physical examination. So those are the four main decisions that we'll make for you when you come in for your initial consultation. Some of the other issues which we'll have to consider are whether or not a lift is required. Most women do not need a breast lift at the time of augmentation. However, some women who have very droopy breasts, especially women who have breastfed and have had several children, will have very droopy breasts, and an augmentation alone will not look right, and a lift will be required. And this is something we'll talk about at the time of your initial consultation as well. If you're young and healthy, no additional blood tests or workup is required before surgery. Women over the age of 40 will require some routine blood work. Women over the age of 50 will also require an EKG. And most women in their late 30s or early 40s should probably get a mammogram as well before surgery. But this is oftentimes based on your risk factors for breast cancer, which is mostly your family history and your personal history, and we'll talk more about this during your visit. I strongly encourage you to go to the website to read more about breast augmentation and the various options, and to look at our before and after photo gallery to see some of the pictures. And then when you come in, we can talk about the pictures that you liked and the shapes that you liked and come up with the option that is best for you. I look forward to seeing you in our visit, and if you have any questions before then, please feel free to contact us.